Hopefully you spent this past holiday weekend enjoying time with your loved ones. I know I did. It was great. But if you happened to peek onto social media at any point over the last few days, you may have seen people started speculating without any real, actual acute evidence that something bad happened to Donald Trump. Now, it's true that until today, the president had not spoken publicly in a week. And this past weekend, his public schedule was very light, a lot of time on the golf course. Something about that combination got the rumor mill turning. People shared images of this little bruise on the president's hand, which is not uncommon for a man of his advanced age. Others shared photos like this one showing what outlets like the Daily Beast have referred to disparagingly as Trump's cankles. Again, there's a non-life-threatening medical explanation for that. Trump has been diagnosed with chronic venous insufficiency, which is a common condition that can cause, pretty intense swelling of the ankles like you see there. Still, the rumors managed to get enough traction that Minnesota's Democratic Governor Tim Walz seemed to acknowledge them at a Labor Day event yesterday.
Thank you all for coming out today. Thank you for believing in these times, because, look, I get it. You get up in the morning and you doom scroll through things, and although I will say this, the last few days you woke up thinking there might be news. Just saying. There will be news sometime, just so you know, there will be news.
I mean, not just, people that are not big fans of the president, but even Trump's allies have been speculating about his poor health.
So as the crisis gets worse, and it's going to get worse, because you can see him declining faster and faster, I predict Trump is going to have some type of collapse within the next 12 months at the current trajectory. I'm not saying he's going to collapse. I'm saying if he doesn't take his foot off the gas pedal, I guarantee you.
Now, Alex Jones is not a medical doctor, not someone that you should really listen to about these matters. And in the end, all the rumor mongering and speculation appears, at least for now, to be totally baseless. As we saw today, the president of the United States is very much alive and seemingly as well as ever, for what that's worth. Although he was asked about the rumors in the Oval Office today, which was a strange moment, and we'll have his answer next.
How did you find out over the weekend that you were dead? You see that?
No.
People didn't see you for a couple days. 1.3 million user engagements as of Saturday morning about your demise.
Really? I didn't see that. I have heard it's sort of crazy, but last week I did numerous news conferences, all successful. They went very well, like this is going very well. And then I didn't do any for 2 days, and they said there must be something wrong with him.
There you have it. The president of the United States is alive and, well, his typical self. But while the online speculation over the long weekend turned out to be just that, the growing curiosity about Trump's well-being might be at least a bit understandable, considering that this White House has not given us any reason to trust what it says on just about anything, especially when it comes to the health of a man who is the oldest to ever take the oath of office. Jamelle Bouie is an opinion columnist for the New York Times. Tim Miller is a former spokesman for the RNC, now writer-at-large for The Bulwark, and they join me now. Tim, I found that I mostly did stay off social media this weekend, but when the times where I sort of managed to dip in, I was like, wait, what's going on? Did I miss something? Did actually something happen? And why do you think there is this sort of phenomenon that has been gathering force recently?
Yeah, I thought about wearing my white lab coat for this segment, Chris, but I decided not to. I think that this phenomenon is based around a few things. One, Donald Trump is extremely, extremely old. And so people have speculation about him. I think that number two, as you alluded to, they lie about everything. And I think that his last medical report said he weighed, he had the physique of Cincinnati Bengals quarterback Joe Burrow, I'm pretty sure, as far as height and weight is concerned. And so they lie about his health. And so when you have things like weird bruises on your hands and huge cankles, and you're not in public for 48 hours, in a different administration, in the Jimmy Carter or George H.W. Bush administration, they would have provided a statement and people would have believed them, right? And they don't, this administration, you can't do that. So I think that's another reason things get out of hand. And, look, the only thing, I have one maybe agreement with Alex Jones, maybe a disagreement with some viewers on this point. But the one other thing that drives this is Trump does have an insane schedule. I mean, he has a very, very public schedule. It's not like he's a coal miner or whatever. It's not a physical job, but he's a 79-year-old man who's out talking like 5 hours a day in front of cameras and
Yes.
and traveling internationally. If you've ever traveled with a senior citizen internationally, do you think when they land they're going to do a 2-hour press conference? Like, so he keeps a very intense schedule, and then he went away for 3 days, and I think he was probably worn out, and I think that led to the speculation.
Jamel, I saw a few people make this point, which really stuck with me, about people who had been in societies that were not democracies, where there's some authoritarian leader, and how common it is when the leader disappears for a little period of time for this speculation about like the health or the death of said leader, that this is like a real trope in closed societies, authoritarian societies. And that chilled me a little bit, and also felt like it had a little kernel of truth to it.
Yeah, it does, I think, have a small kernel of truth to it, that we are already, I think, collectively getting acculturated to looking at the president in this manner as some sort of like leader who has to be present all the time, or people start getting concerned, worried, I think in this case a little excited that something may have happened. I think it's a funny reflection of how central the presidency has become to American political culture. That there is this kind of constant obsession about where the president may be, if they're in the public eye, if they're doing something. And I find that, I mean, separate and apart from Trump, I find the centrality of the president to everything we think about American politics to be not good, to be actually kind of one of the things that has fed into how we've got to where we are today.
I totally 100% agree with that. And I do think also, Tim, part of what's driving it as well is I think there's a sense a lot of people had that there was a lot of speculation about Biden's health. There was a lot of talking about Biden's health. There's been even a long sort of mea culpa, sort of self-recrimination in some of the press that there wasn't enough talk about Biden's health. And I think some people are like, well, this guy is like super old and does clearly have some physical issues in front of him, and also does seem to like blank out sometimes, or like his brain seems mushy, although is it any mushier than it was before? I don't know. And a little bit of like frustration that it's not like even Steven, I guess. Yeah.
I think that there's probably some of that. It's also on people's mind, right? I mean, like the gerontocracy side of this thing.
Yes.
And look, there, you also had Mitch McConnell, froze a couple of times recently. We've had this in several other cases. So I think that is something that leads to it. But I could not agree more with Jamel, just by the way, just both on this notion that like this does carry echoes of what you see in other countries.
Joining me now, Dr. Paul Offit, Director of Vaccine Education Center and member of the FDA Vaccines and Related Biological Products Advisory Committee. It's good to have you back on the program, Doctor. Right now, COVID cases on the rise, school back in session. What's the public health impact, potentially, of the president now questioning the vaccine's efficacy?
Thank you, President Trump, for Operation Warp Speed. Because of that vaccine in 2021, when the vaccine became available, you were 12 times less likely to be hospitalized and 12 times less likely to die if you were vaccinated than if you weren't. The following year, it was about 6 times less likely to be hospitalized and less likely to be vaccinated, thanks to that vaccine. That vaccine, depending on whose data you look at, saved between 2 and 3 million American lives, and about 200 to 250,000 people who chose not to get that vaccine chose their own death. It was a remarkable accomplishment. I don't know what he's talking about.
Yeah. So in other words, there is no question scientifically about how successful it has been. But now the Kaiser Family Foundation reports that manufacturers Eli Lilly, Pfizer, they're worried that their production could be impacted. Is this a reality? And if so, what do we do about it within the vaccine and medical community? Are they prepared?
Yes, it is a reality. I think we have, as a Secretary of Health and Human Services, a man who for 20 years has been a virulent anti-vaccine activist and science denialist who has said the COVID vaccines were, in his words, the deadliest vaccines ever made. He's going to do everything he can to make that vaccine less available, less affordable, and more feared. And what's going to be the consequence is that there will be people who will suffer that disease who didn't need to. This is a preventable infection. And the goal of that vaccine has been met, which is to prevent serious disease, meaning keep you out of the hospital, keep you out of the ICU, keep you out of the morgue. It's not to prevent mild or moderate illness, and I think people need to understand that.
So we mentioned that RFK Jr. is due in front of a Senate committee on Thursday. What questions would you like to see lawmakers ask him?
I'd like to ask him this question. He is now the Secretary of Health and Human Services during the biggest measles epidemic we have had in 33 years. We've had 2 children die of measles in this country, the first child death since 2003. I would like to ask him why, in the midst of this epidemic, he said on national television that the measles vaccine kills people every year, that the measles vaccine causes blindness and deafness. Why would he say that in the midst of an epidemic when it's clearly false? Why would he do something so incredibly irresponsible? And why then should he still remain as Secretary of Health and Human Services?
So then the net effect of that is some people listen, they go to the CDC website. They're getting information that's different than they would have gotten a year ago. So what needs to happen to help Americans really understand the truth about vaccines, Doctor?
It's confusing. I think where we are now is that RFK Jr. fired 17 members from the Advisory Committee for Immunization Practice who had tremendous expertise and experience.
What you're witnessing there is Donald's health concerns not going away. I know a lot of people literally, we talked about it this weekend, literally thought he was gone. Like, gone permanently. Gone. And then he wasn't, obviously. Like, I think, we were probably like, he's probably not, you know what I mean? But he looks really bad. And there's two health emergencies going around right now in Trump land. One, there's the speculation, but I think some of it based on reasoned speculation about Donald Trump's health. How sick is he, and is he being honest? Because he has earned a reputation for being less than honest about his health. There's one example where it came out after he lost the last election, the 2020 election, that he undersold how sick he was during the pandemic, that he was much sicker than what they said. Now, I think we all understood that, but that he was not being forthright. And then also there was all those reports going all the way back to his first run where he had that doctor that was kind of weird. Apparently, a lot of people thought that his health appraisals in the last couple elections were questionable, to say the least, although that's an opinion that's not based on any kind of official analysis. But it's always gave people this sense that, okay, Donald is sick, he's getting sicker, he's old and he's getting older, and he's not always been honest with us about his health. And so you combine that with the CDC health emergency, because that's also a health emergency, and Donald Trump's being hit by it because he created it, and doctors, whether it's medical doctors or scientific doctors, are uniting to say that, politics aside, this man is a danger. And ironic as it is, given that he's old and probably sick, Donald's putting his own life at risk because he's the one that would suffer from an immune issue given his other health concerns.